Welcome back to the Living Diabetes podcast. I am your host, and today we are talking about your eyes, specifically diabetic retinopathy, which is the leading cause of blindness in working age adults. This is a complication that can be prevented and treated, but only if it is caught early, and that is why this conversation matters. Diabetic retinopathy affects the small blood vessels in the retina, the light sensitive tissue at the back of your eye. Over time, high blood sugar damages these tiny vessels, causing them to leak, swell, or close off entirely. In advanced stages, new abnormal blood vessels grow on the surface of the retina, and these fragile vessels can bleed, causing sudden vision loss. The difficult thing about retinopathy is that it often causes no symptoms in its early stages. By the time you notice changes in your vision, the disease may already be advanced. Let us walk through the stages. The first stage is mild non-proliferative retinopathy. This is where small areas of balloon-like swelling, called microaneurysms, develop in the retinal blood vessels. At this stage, vision is typically unaffected, and many people have no idea anything is happening. The second stage is moderate non-proliferative retinopathy. More blood vessels become affected. Some may swell and lose their ability to carry blood properly. This can trigger changes in the appearance of the retina that an eye specialist can detect during an examination. The third stage is severe non-proliferative retinopathy. At this point, a significant number of blood vessels are blocked, depriving areas of the retina of their blood supply. The retina sends signals to the body to grow new blood vessels, and this is where things become dangerous. The fourth and most advanced stage is proliferative diabetic retinopathy. New blood vessels grow along the retina and into the vitreous gel inside the eye. These new vessels are extremely fragile and prone to leaking and bleeding. If they bleed into the vitreous, it causes floaters or even complete vision obstruction. Scar tissue can form, pulling the retina away from the back of the eye, which is a retinal detachment. This is a medical emergency. At any stage, diabetic macular edema can also occur. This is swelling in the macula, the central part of the retina responsible for sharp, detailed vision. Macular edema causes blurring and distortion of central vision and is the most common cause of vision loss from diabetic retinopathy. Now, who is at risk? Duration of diabetes is the strongest risk factor. After 20 years of diabetes, nearly all people with type 1 and over 60% of people with type 2 will have some degree of retinopathy. Poor blood sugar control significantly accelerates the process. High blood pressure is another major contributor. Pregnancy can also worsen pre-existing retinopathy. The good news is that early detection and treatment can prevent up to 95% of diabetes-related vision loss. This is why annual dilated eye examinations are not optional, they are essential. During a dilated exam, your ophthalmologist or optometrist puts drops in your eyes to widen your pupils, allowing them to see the retina clearly. They are looking for the exact changes I described. Modern retinal imaging, including optical coherence tomography and retinal photography, can detect changes before they are visible to the naked eye. Treatment depends on the stage. For early non-proliferative retinopathy, the primary treatment is optimizing blood sugar, blood pressure, and cholesterol control. This can slow progression significantly. For more advanced disease, laser treatment, called photocoagulation, can seal leaking blood vessels and reduce the growth of abnormal new vessels. Anti-VEGF injections, which are medications injected directly into the eye, have revolutionized the treatment of both proliferative retinopathy and macular edema. These drugs block the protein that stimulates abnormal vessel growth and reduce swelling. What can you do right now? First, get your annual eye exam if you have not already. Do not wait for symptoms. Second, keep your A1C as close to target as possible. Every percentage point reduction in A1C reduces the risk of retinopathy progression. Third, manage your blood pressure. The combination of good glucose and good blood pressure control is more powerful than either alone. Fourth, if you smoke, stop. Smoking accelerates vascular damage throughout the body, including the retina. Your vision is precious, and diabetic retinopathy is one of the most preventable serious complications of diabetes. The tools exist to protect your eyes. The key is using them before symptoms appear. Follow us on social media for daily updates and more content. Until next time, take care of yourselves.